Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Informed Immunity, a wellness evolution podcast in which we tackle the crucial topics that impact community health, respiratory infectious diseases, vaccine advocacy, and more. I'm Angel Tapia, your guide into the world of community health, and a senior manager of Hispanic community outreach at the Global Healthy Living Foundation. Joining me is my colleague, Dr. Daniel Hernandez, Director of Medical Affairs and Hispanic Outreach. Together, we're here to break down complex health topics into easily understandable insights, answering the questions you've always had about vaccines and more. Today, we'll be answering questions from people all over the United States and Puerto Rico about RSV vaccines, flu vaccines, pneumococcal vaccines, and COVID-19 vaccines for people with chronic illnesses.
That's right, Angel. I'm excited to be here today to help answer the questions. Vaccines are one of the most important public health interventions in history, and it's important more than ever to stay up to date on our vaccinations.
Perfect. Let's get started with our first question. Why do I always feel like I get sick after a flu shot?
That is such a common statement, that you get sick after a flu shot. It's normal to feel a little under the weather after the flu shot. This is because the vaccine is causing your body to mount an immune response to the flu virus. The immune response can cause some of the same symptoms as the flu, such as fatigue, headache, muscle aches, even a low-grade fever. But these symptoms are usually mild and go away on their own within a few days. However, it's important to note that the flu shot cannot give you the flu. That's very, very important. The vaccine contains inactivated flu viruses, which means they cannot replicate and cause illness. If you are concerned about side effects of the flu shot, talk to your doctor. They can help you weigh the risks and benefits of the vaccine and decide if it's right for you. Here's some tips to help reduce the side effects of the flu shot. Get the flu shot in your non-dominant arm. So if you're right-handed, get the shot in your left hand. Apply a warm compress to the injection site. Drink plenty of fluid. Get plenty of rest. And over-the-counter pain relievers such as ibuprofen or Tylenol can be used to relieve pain and fever.
Now on to our next question. What is RSV and why should I get vaccinated against it?
RSV, or respiratory syncytial virus, is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but in infants and older adults and those with chronic conditions such as asthma, diabetes, rheumatoid arthritis, they're more likely to develop severe RSV and need hospitalization. So there is this vaccine, the RSV vaccine, available to protect older adults from severe RSV. And it's very important that if you do fall under categories that are at high risk for being affected with RSV, you get vaccinated.
Next question. What is the flu and why should I get vaccinated against it?
The flu is an influenza virus, right? And it's a contagious respiratory illness. And what this means is it affects our respiratory system. It can cause mild to severe illness, and at times it can lead to hospitalization or death. And this is very serious. Not many people take this as serious as possible simply because we hear that the flu, the seasonal flu now, it's not seasonal actually. It is throughout the year, but there are moments where it is more prevalent than others during the year. And just like we spoke about RSV, this can be very serious for certain people. So the best way to protect ourselves from the flu is with the flu vaccine. The flu can cause pneumonia, bronchitis, and other complications that can lead to hospitalization. And if you already are suffering from a respiratory illness or a condition which reduces your immune system, it's very difficult to fight off this virus. The way that we can prevent that from happening is with a vaccine. If you have the vaccine, you have the antibodies, you have this tool set within your body to fight the virus and to more likely prevent you going to the hospital or having severe complications.
Next question. What are pneumococcal diseases and why should I get vaccinated against them?
You should care about pneumococcal diseases because they can be serious, especially for young children, those with chronic conditions, and older adults. Pneumococcal diseases can cause a variety of infections, including pneumonia, meningitis, ear infections, so blood disease as well. Pneumonia is an infection of the lungs. It is a leading cause of death from an infectious disease in children under the age of 5. It can also be serious for adults, especially those who have chronic medical conditions or weakened immune systems. Meningitis is an inflammation of the lining around the brain and spinal cord. So pneumococcal diseases can cause meningitis, and it can lead to a serious infection that can lead to brain damage, hearing loss, and even death. The way that we can prevent this is through the pneumococcal vaccine, which is safe and effective for people of all ages. The CDC recommends that all children get vaccinated against pneumococcal diseases, and the CDC also recommends that adults 65 years of age and older get vaccinated against pneumococcal diseases. As I mentioned, it's very serious and it can even lead to death. It can also be very costly, both in terms of medical bills and can't go to your job, you end up hospitalized. So it's so easy to prevent this. Simply, you go to your doctor, you get a vaccine, you build this immune system against pneumococcal diseases, and you're good to go. So it's something that we have to take seriously and be proactive of defending ourselves against.
Thank you, Daniel, for all of that detail. I want to move to our next question that we received, which is, COVID-19 pandemic is over. Why should I get vaccinated for something that I need to get tested to know if I have in the first place?
Vaccines are the best way to protect yourself and your community from COVID-19. They're safe, effective, and widely available. We have to remember that COVID-19 is still a serious threat even if the pandemic is over. The virus is still circulating, new variants can emerge at any time, and vaccines can help to protect you from serious illness, hospitalization, and death, even from new variants. It's not just that, it also protects those around us. So if you don't have a chronic disease, or if you are not elderly or a child, it doesn't matter because the vaccination will not only protect yourself, but it will protect those around you. It's important to note that COVID-19 can have long-term health consequences as well. Even people who have mild cases of COVID-19 can later develop long COVID. We've heard about it, and it's very true. A condition that causes a variety of symptoms, including fatigue, shortness of breath, brain fog, chest pain. It can even lead to the reduction or complete elimination of your smell or taste sensors. So all of these are very, very important to keep in mind. Long COVID can last for months or even years, and vaccination can reduce your risk of developing long COVID. Vaccines are very simple and effective ways to protect yourself and your community from COVID-19. And it's also a way to not only, like I mentioned, protect yourself, but also those around you.
Thank you so much for sharing that personal information. And one of the other questions that we received is, who should get vaccinated against COVID-19?
This is an easy one. The CDC recommends that everyone 6 months of age and older get vaccinated against COVID-19. This is especially important for people with chronic illnesses, pregnant women, and healthcare workers.
On to our next question. Can I get vaccinated against RSV, the flu, pneumococcal diseases, and COVID-19 all at the same time?
Yes, you can get vaccinated against RSV, the flu, pneumococcal diseases, and COVID-19 all at the same time. There's no evidence that getting multiple vaccines at the same time is any less safe or effective than getting them one at a time. In fact, getting multiple vaccines at the same time can be more convenient and can help you stay up to date on all of your vaccinations.
And now on to our last question. What if I have a chronic illness? Should I still get vaccinated against RSV, the flu, pneumococcal diseases, and COVID-19?
Definitely. People with chronic illnesses should still get vaccinated against all of them. In fact, people with chronic illnesses are at higher risk of serious complications from these illnesses, so it's especially important for them to get vaccinated. Vaccines are safe and effective for people with chronic illnesses. The CDC recommends that all adults with chronic illnesses get vaccinated against the flu and pneumococcal diseases. Adults with chronic illnesses who are at high risk of getting RSV may also want to consider getting vaccinated against RSV. And if you have a chronic illness and you're not sure whether you should get vaccinated against these, talk to your doctor. They can help you to assess your individual risk and make the best decision for your health. Here's some benefits of getting vaccinated against these. They can protect you from serious illnesses, hospitalization, and death. They can reduce the risk of complication from these illnesses. Vaccines can help to improve your quality of life, and vaccines can help to protect your loved ones from getting sick. So remember, getting vaccine is something that is convenient, that is something that you can do proactively against getting infected from these viruses and not having serious complications, as well as helping those around you be safe.
Thank you so much, Daniel, for answering the questions and providing your insight and research on these topics. And before we go, as we've done in each episode, why don't we offer our listeners a refresher on vaccines, a vaccine 101, so to speak? Let's start with, what are vaccines?
Vaccines teach your body how to produce antibodies against the virus you are being vaccinated for. This helps protect you from infection in the short term. Vaccines also help train other immune cells known as B cells and T cells. T cells recognize when a pathogen enters the body and attacks infected cells. And B cells produce antibodies that directly interact with the pathogen to neutralize them. These have something like a memory that allows them to identify and respond every time a given pathogen enters the body.
And can you tell us what role boosters play in immunity?
Boosters, or additional doses of any vaccine, provoke an immune response and further strengthen your immune system, both in the short term and the long term. That is why doses are spaced apart. They help reactivate and strengthen the immune response for the short term and also the long term.
And can you shed some light on why some people do have side effects?
Sure. So vaccines induce an immune response because they introduce sometimes a part of the virus, but also sometimes just a little bit of an instruction of how to fight this virus. It is a bit of the virus. It's not enough to fully infect you with a disease, but many people might have some side effects in response to the vaccine because the immune system is learning how to fight it off. And it is fighting it off in a very minor way. So the most important thing to remember is that the vaccine cannot give you the disease you are being vaccinated against. You might get some pain and redness at the injection site, some fatigue, fever, headache, but these should go away in a few days. If they haven't gone in a few days, it's very important to speak to your physician. And also something to note is if you get a vaccine, you should stay in the clinic or wherever you're getting your vaccination on site for around 15 minutes afterwards, just in case of an allergic reaction. Allergic reactions are very rare, but it's important to make sure that you're not one of the people that are allergic to a specific vaccine. And if you are, you're in the right place in order for the correct intervention to happen quickly.
Thank you for all of this information, Daniel. It never hurts to have a refresher and remind ourselves of the importance of our vaccines. And for more information, listeners can visit the CDC or WHO websites for more evidence-based information. Thank you for tuning in, and until next time, stay informed and stay healthy. Thank you for joining us on this episode of Informed Immunity, a Wellness Evolution podcast. We hope our discussions inspire meaningful conversations with your loved ones. For our Spanish-speaking listeners, episodes are also available in Espanol. If you have any questions or topic you'd like us to address, email us at podcasts@ghlf.org. And you can find all of GHLF's podcasts at ghlf.org/listen. If you like this podcast, give us a rating and write a review on Apple Podcasts and subscribe to us wherever you listen. It'll help more people like you find us. I'm Angel Tapia.
And I'm Dr. Daniel Hernandez.
Until next time, stay informed and stay safe.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.